when you're having a alarm, you need to have an alarm because just for safety. And your nurse may having multiple tasks. They may be giving IVs. They may be getting medicine. So alarm will remind them that something is wrong and you can go and attend to it. And rapid detection will be life-saving. It's very important that you detect and address these alarms. This is in my hospital a long time ago. The most used button is the silence button. See how worn out it is? You keep pushing on the silence button and you shut off the alarm. But please don't do that. Please make sure, I don't hear anybody laughing, but I guess it's one-way audio. But you need to really make sure that the silence button is carefully dealt with, because you have to know why the alarm came. Sometimes you can choose to ignore the alarm, but you have to know why the alarm came. The alarm might come because the patient has a high PEEP and you did not set the pressure to go up. So for example, when you're setting a PEEP alarm, you can say, if the pressure goes up beyond 15, please beep. But if your pressure is 18 all the time and you decided you're going to tolerate 18 pressure, you will unnecessarily get an extra alarm. You can change that. So we talked about the concept of the peak alarm. You should set that about more than 30. We talked about minute ventilation, meaning if the patient is not breathing well on their own and the pressure volume is coming down, you need to look into that. And low tidal volume alarm, where you're having a situation where your volume is lost. For example, the machine disconnected. You will notice that the volume coming back is much less and the alarm will go off. So your alarm you should set based on what is your goal of the ventilation. If somebody has metabolic acidosis, somebody with diabetes where the insulin is not enough, sugar went up, ketones were formed, there is acid in the blood, the body is trying to blow out the acid, so you get tachypnea because of metabolic acidosis. When you have metabolic acidosis, your breathing rate is going to be high. So no point setting your alarm for a rate of 15 because the patient may be breathing at 25. So that is an alarm that you can adjust. You can also set the alarm for the FiO2, set the alarm for the peak inspiratory pressure, the flow rate alarm you can set. Now, sometimes people have a humidifier along with the machine where you can adjust the water temperature so that the water, which is humidifying the air going into the patient, is in a comfortable temperature. In that situation, you have to consider you doing a water temperature alarm. There are some good habits. This is probably the most important. Go to the bedside, of course, wear your protective equipment. Anusha, by the way, the pressure control question, we went over this earlier. Please look at the earlier answers. So when you look at the good habits, so go to the bedside, check the settings at the beginning of your shift. Again, go to the bedside, confirm your alarm is audible and you can hear it, adjust the volume. Look for disconnections, look for water in the tubes, look for high pressure, any reason is there. Look for abnormal physiology, meaning one lung collapsed, one lung working. Is there a respiratory chest movement is not normal? Look for cyanosis. Look and see if the patient has clubbing and this is a chronic patient with, say, bronchiectasis or tuberculosis. Activate your rapid response. In other words, if there is an alarm that you need to address, immediately call for help, because one person may not be able to do it, especially with a COVID patient. You should not go into the room unless you have protective equipment. It can be dangerous for the patient, but your life is more important. You have to make sure you do it safely. You need to also look at manual ventilation, where you have a bag mask right next to the patient available so that you're able to bag the patient in an emergency. You have to report this incident so that your quality control can make sure it doesn't happen again. For example, somebody forgot to keep the bag mask in the room. That something should not happen. Go back to the bedside, check your pulse oximeter alarm, go back to your bedside. So in your shift, make sure that you are at the next, near the ventilator, near the patient for several times. Of course, with COVID-19, you might have seen all these Twitter feeds and WhatsApp videos where you can actually remove the ventilator. We saw the McWeight ventilator. Very interestingly, the whole monitor can come off. It can be outside the room. It has a long cable and that part can be outside. You can control the ventilator from inside.